Hello, sir. Good afternoon, sir.
Good
Once more,
afternoon.
my name is Richard Mina from Magic TV.
Okay.
Yes, sir. Yes, sir. Can you please tell us small about this monkeypox because plenty people know get understanding and know about answer.
Yeah, formerly they call them monkeypox, but now since 2023, the WHO say the new name na Mpox. Na Mpox, Mpox they na almost all parts of the world. So I didn't get the first case January 10 this year. Since then, we don't get a total of 125 confirmed cases with 2 deaths, and we get out of the 16 districts, we get 8 of the districts with the report cases.
So what's the current situation as along right now?
Well, as I explained, we get a total of 125 cases and 2 deaths, and we get an outbreak because just one case now an outbreak, and we get now almost all the countries and the sub-region with different WHO regions or continents they report cases. And Mpox now the disease of contact, meaning if somebody gets it can easily pass on to some other person to bodily fluids and even heavy droplets. So they always advise if somebody gets fever and rash, now a suspected case and for report na the nearest health facility, or we call 117. And anybody we get Mpox, we don't begin show signs and symptoms, it can likely pass on to other person. So we always advise say them people and they for make sure say when you see somebody like that, they for go near them as I say corona, say go to the nearest health facility. Or that kind of person we get Mpox. If you share beddings with that person for instance in bedspread, in pillowcase, even in clothes wey they wear, in towel, or anything we use to share with them, you will likely forget them. So it's so easy for prevent Mpox because as I say, the measures they were they say hand washing is very easy for carry out, and contact. When you contact somebody we get Mpox, the person will likely forgive. But as we talked to just last Thursday, we don't launch the Mpox vaccination aside, so we don't get another layer of protection with the vaccine. But since 1,300 doses of vaccine we get in the country, not so everybody will get them. But the good thing is there are other which we can call non-pharmaceutical interventions. And then non-pharmaceutical interventions include social distancing, including hand washing, and even reporting cases to the nearest health facility. But the people we will give the vaccine for now, frontline workers, and also contacts and contacts of contacts. Them people we go make sure say we give them the immaculate because we want for protect the health workers and the contacts information or even get them.
And which strategy una don use for ensure say the distribution will be equal for the monkeypox?
What do you mean?
Strategy.
The strategy.
Yeah, which strategy we don't use for make
Yes,
which
sir.
distribution is
Yeah, I mean all man get equal distribution
of what?
for the monkeypox vaccine.
Okay, the monkeypox vaccine, there will be no equal distribution as I say. The vaccine are just one layer of protection. We get other layers of protection for non-pharmaceutical intervention. With a country of 8 million people, if we get 61,300 doses, you're not going to forget everybody. So we dey prioritize, people that really have at very high risk, like we health workers. We record on show say some nurses and other health workers they don't contact the disease. As Ebola, we know say with nurses, with doctors, them in die, even COVID. So we dey try for protect them and they when a frontline worker and anybody we they at the forefront for fight this disease. And we also the contact them. Somebody we contact the disease, he more likely forget them than the person will not contact them. So and we dey try for what we call say break the chain of transmission. So now them people and they will go key. But as more and more vaccines become available in the country, we will expand. You will recall that when we been get COVID in this country, the COVID vaccination, we been start with 65 years and above. But today, anybody who eligible can take that vaccine day. So the vaccine not to just in normal day for prevention, as I say, you can wash your hand, you can make sure say you don't need somebody will get mpox, you can make sure say if somebody get mpox you report na the nearest health facility or report 117. You can make sure say person get mpox, you not use any of your beddings, you not go close to them, and by so doing you not be able to forget them.
Yes, sir. So, how important is this vaccine for stop the spread of the virus?
Well, vaccination, not only mpox vaccination all over the world, now a very good arsenal within our weapon we really prevent diseases. So it's very very good because the vaccines now WHO don't pre-qualify them vaccine and even now we own Sierra Leone context, the pharmacy board do approve of them, and even the NITAG, we own technical group in Sierra Leone, don't say the vaccine is safe and effective. So the vaccines are very effective. You go recall, the long years ago, now this same vaccine we use for them be used for make we eradicate smallpox na the world where them dey give and smallpox not dey again na the world because of vaccine. So if we continue for take this vaccine and other measures we will make sure say we put this outbreak behind me because all over the world, mpox day, and we will make sure say we do all what we can do for make this we break what you call the transmission chain. Because if we continue in this, because it is Sierra Leone, it is Guinea, it is Ivory Coast, it is Liberia, it is all most countries in Asia, Americas, Europe. If we not do anything, this disease will last for some 2-3 years and will not go on down. And that make the government and partners they make sure say we do all what you can do or make sure say we stop the transmission chain.
Wetin are the public awareness for the monkeypox vaccine for rise in affected area?
The mpox vaccine, as I say, they do a lot of awareness raising. For instance, last Thursday we launched at CCSL. We hundreds of people did it, and we sensitize different communities and we make sure say this because na key populations with the key special groups. Then groups and they sensitize them, as I say, since yesterday. From the first day, the first person we take on the Minister of Health, and followed by other senior government officials, including myself, we and the Health Education Program Manager at TECAM on the very first day. And even yesterday, they don't begin roll them, and today, they don't begin roll them out to different areas for people, as I say, where we look as people, we frontline people, and people that we urgently need the vaccines.
And wetin are the challenges the way the health organization dey face for stop this monkeypox vaccine globally?
Well, globally, I can begin first with we own Sierra Leone context. One of the big challenges we face now that of rumors and misconceptions and what we can call fake news. People they always get the perception say monkeypox or mpox not in a salon and lie people in the lie. And if you get that thinking, they a very very sad because if you believe say sickness no dey, you go easily get and spread am or even die of the disease. Mpox is very very rare, rare. Na thing we dey. So but some people then they say not to mpox no dey, and if then they talk to and some of the people them, the influential people and other people them will follow them. And unfortunately, person sick and because of their own perceptions and waiting and they tell people them, or even in die, now they can will cause people them for die. So I tell people and say this not to make up story, mpox here, we don't get 125 people in a salon. We don't confirm say they get them. A good number of them don't discharge, from if they not get them again. But some still we get active cases that we still not discharge it. And unfortunately, 2 of them people in the don't die. So that's not one challenge. The perceptions and way people they not believe and some man them they not they adhere to preventive measure. Where you say what's your hand and go say, hey, you not give me food, why you ask me for what's my hand? Or when you tell them say not do this, now so for do for prevent them, then they want for not take this thing serious. So these are some of the challenges that we will get.
Yes, sir. So as we conclude, wetin are the important message we go left to the public?
The important message is mpox dey, and when we want to make sure say anybody we don't get right now with the show signs and symptoms, if we for pull them out so that we go monitor them and get good care, they go well, and the one that we don't contact them, we line list them, we observe them so that they don't go spread and get other people. And we get a campaign we they do right now in the western area, especially that make we see a lot of cases in the Komoto call them operation find them out. One find all the one that we get mpox thing out so that we pull them out and we make sure say we get them home treatment, and the one that we cannot close to them we will call contact, we observe them so that they no go get the sick, because mpox now like any other sick, and we expect say if you come early you will die of this disease. And as I say, we don't get 125, now 2 people in on die. So meaning the 123 people in still they alive, and out of that, over half of them people in the over 60 of them they don't discharge and they don't fully recover.
Thank you. Plenty, thank you, sir.
You're welcome.